The week will see the world observe International Condom Day, which aims to spread knowledge and awareness on the advantages and importance of using condoms as a safety tool. In South Africa, a concerning rise in the spread of sexually transmitted infections has been observed, with the increase attributed to individuals ignoring condoms in favour of more expensive or limited tools like PrEP for the prevention of HIV. Experts say this is a foreboding observation that, if not addressed, will see a reflective rise in the rates of HIV. AIDS Healthcare Foundation Advocacy's Policy and Marketing Manager for the Southern Africa region, Ngaatendwe Murombedzi, joins us now for more. I know I didn't say your surname right. How do you say your surname?
Good evening,
Apologies.
Juliet. Murombedzi.
Murombedzi, there we go. We said it before.
Thank you so much for having me, Juliet.
Let's talk through the difference between PrEP and using condoms in terms of preventing the spread of HIV, AIDS, and sexually transmitted diseases, because there's a bit of a difference, isn't there?
Of course, of course. So PrEP is the latest kid on the block, a biomedical intervention prevention modality that's becoming increasingly available to our communities. Essentially what it does, PrEP is pre-exposure prophylaxis. There's also PEP, post-exposure prophylaxis, and it provides you protection if used correctly against HIV only. Right. Now, condoms provide you with dual protection against the HIV virus, but also against fluid-borne STIs. So why we continue to advocate for condoms is because PrEP will give you that coverage that you need, but only if you use it correctly, and you can access it against HIV. But still, like you said in your introduction, there is an alarmingly increasing rate of STIs. And so condoms remain the only way to prevent yourself against both.
Now, government's committed resources to HIV prevention. What should be done to ensure this funding leads to real impacts?
You know, the funding gaps are threatened. The foundation of what we are investing in prevention modalities as a full package is threatened. We've seen what that has done to our HIV response. Now, this threatens our HIV gains, meaning that a lot of our communities where we are already struggling to reach them with accessible, affordable modalities like condoms are now even more invisible to us. So the funding is just one element. The other component of that is literacy. You know, we need to ensure that even if the biomedical PrEP are being made available amongst another full basket of prevention commodities, that literacy is also available. So we need to also take those very little HIV response, HIV prevention resources that we have to ensure that also communities are empowered, there is awareness, and literacy is made available to ensure that we curb the spread of HIV and STIs.
Now, International Condom Day is coming up. What's being done to create more awareness and to cover these topics that you and I are discussing right now? You know, the difference between PrEP and PEP, you said?
Yes, yes, yes.
And using condoms. Is there enough awareness?
So ICD, 13 February, absolutely excited for the day, was actually established by the AIDS Healthcare Foundation in 2009. And the goal of it was to ensure that we keep condoms on the agenda as an accessible, as a very affordable modality. Now, we, across our 50 countries of operation and 15 on the African continent, commemorate doing a variety of activities that are targeting the communities, but also high-level stakeholders. We engage our decision makers, we continue to present the evidence about why we need to invest in condoms, but also we collaborate with the communities on the ground. You know, I remember a time when ABC was the campaign, Scrutinize and Condomize, and then at the time it was because there was no treatment for HIV, so death was the only alternative if you did contract HIV. But now we're fighting against the advancement and accessibility of art, and so we are needing to ensure that communities still understand that HIV is still a very real threat to our public health. But while we are doing that, how do we continue to sensitize people, balancing our messaging of condoms, collaborating with people that are in the whole discussion of PrEP and PEP, but also helping us to understand from communities, how can we make this better? It's not that people don't know about condoms. It's not that people don't know about HIV or STIs, but there is a gap in the way we are communicating and collaborating and reaching key and vulnerable populations, adolescent girls remain a very critical demographic. And we also see that the lack of comprehensive sexuality education is also leading to staggering rates of teenage pregnancy, which means that gap has got rippling effects into the society, into the economy of our countries. So we want to keep condoms there. We want to say, governments, how can we help you reach the communities? We want to say to people that are not using condoms, come and talk to us. Why don't you want to use condoms? Are they that you are not finding that they're effective? What are the myths? What are the lack of facts that are on the ground? You know, what are people purporting that are that is resulting in limited or low use of condoms amongst our populations?
Is it possible that we perhaps did ourselves a disservice when AIDS, when it was rife? It's still rife, don't get me wrong, but when we were really driving home the message that without a condom, there's every chance you'll get HIV/AIDS and there's every chance you will die. And we focus so much on HIV/AIDS and dying from that. Now that, as you say, there's PrEP and PEP, have people forgotten how serious sexually transmitted infections and diseases really are? Because at the time, going back, when AIDS first reared its ugly, ugly head, we'll focus so much on HIV/AIDS, which is still a sexually transmitted disease, of course. But we've forgotten about how deadly the others can actually be.
Absolutely. We're dealing with humans. And largely what we are trying to fight against is behavior. And I like to say that we're probably the least self-preserving generation of humanity, because there are a lot of things that threaten our overall health that we choose to move against or ignore. Back then, death was a certain outcome if you contracted HIV. Now you are able to live and thrive while living with HIV. You can have your children, you can move on. In fact, you might be healthier than somebody who is not living with HIV because of the rise of lifestyle diseases, your non-communicable diseases. But we are trying to now understand that behavior element. Why is it that people no longer fear? That's not something that research alone is going to help us. That's not something that science alone is going to help us. That's not something that political will alone is going to help us. So we need to really look at a whole of human approach towards condom programming. We need to get the parents in there. We need to get what culture is saying. We need to get what religion is saying. We need to also understand that the policymakers work on evidence, but evidence is more powerful if it is a story. There are people behind the numbers when we say there's increase in STIs, increase in HIV incident. Those people, why is this happening? You know, there's still stigma. It's still a big thing that we are trying to circumvent, even around treatment. Now imagine trying to bring that to prevention. There's a lot of secrecy around sexuality. There's around sexual activity that we are not confronting. But it's not just for one demographic of people in the advocacy space to be leading, but it's for everyone to come and say, you know, maybe people don't want to see me, who looks kind of like their aunt, coming to tell them about condoms. But we are now encouraging peer-to-peer discussions around reproductive health so that young people can speak to each other. And we need to be very realistic that the behavior that we are seeing now is also evidence of other social ills, transactional sex, risky sexual behavior because of alcohol, drug usage. So it's really not just, it's not a lateral approach that we need to have. It's not a vertical alone approach, but we really need to take it a different social strata, and we need to bring everyone there. By the time we go to the policymakers, we need to say that invest in condoms because of all of this evidence that we've been able to gather. You know, back then, the fear of death. Yeah. Now I don't fear death because I can live and I thrive. So what are you putting on the table for me? Now we have to educate people around the staggering rates of STIs. What does that do to your body? What does that do to your lifestyle? What does that do to your partner? You know, and when we talk about in the context of a partner, now we are looking at what are the honest conversations we are having with each other, with our communities. Do we know how to talk to each other about safe sex? You know, sometimes it's a power imbalance in a relationship that's the barrier to proper condom use. Sometimes people don't even know where to get them, how to access them, how to use it, how to dispose of it, how to check the integrity. So we really need to take a whole of society approach and put understanding behavior, bring psychologists. Why are people not fearing this very thing that can threaten their well-being and opting for something that is easy immediately, but not entirely accessible, but also very expensive for the government, and doing away with this thing that is very affordable, mostly free. I mean, AHF provides condoms in our supported countries, mostly free. And you know, what can we do? Social media is rife with messaging, but how do we harness that and use media advocacy, collaborate with media houses like yourself to make sure that the condom reaches far and wide?
I'm just thinking as you're speaking, and I was going to ask you about social media. I'll get that to that in just a little second, because that goes hand in hand with my next question. When you look at the youth of today, our teenagers and late teens and early adults, they weren't around when AIDS, I want to say started, but that's not entirely correct either. But they were not around when there was that fear of HIV/AIDS. There was fear of death and sexually transmitted diseases. You know, the messages were driven home so hard and so fast on an international scale in South Africa, hugely so. They didn't experience that. So I'm wondering if we need to drive it home a lot harder and stronger now with the younger generation. And as you said, social media could indeed be the answer in pushing that, pushing that forward and that information. Because we don't talk about it.
Yes.
We don't. But if you look at social media, they talk about everything else.
Yes.
So let's have that conversation.
You know, young people sometimes trying to be discreet, trying to be morally right, but speaking in an echo chamber of people of the same age, but they didn't live through that time. Yeah. So a fun fact, South Africa was our first program as AHF on the African continent at the height. I think they still call it the dark ages of HIV and AIDS. People were dying left, right, and center. Yes. I don't think there was anyone at that time or families currently who didn't lose someone to AIDS. And for some people, that is a reminder in itself, but we don't have enough transmission of information. You know, there used to be a time in our history before social media, before TV, where the only way to sit and entertain yourselves was to share stories. And it was on an intergenerational transference of information, self-preserving strategies. And I honestly feel like if I had one call to action for young people, sit with somebody of that ABC generation, somebody who was there with the scrutinized, condomized. I remember that advert so well. And sit with somebody who lost someone, who held a hand when somebody was taking their last breath, who navigated when their family was isolated because somebody in their midst had AIDS, somebody who knew a parent who couldn't use a teaspoon in somebody else's house because they didn't know that AIDS couldn't be transmitted through saliva. Yes. Those realities that speak to the very essence of what that meant for individuals, not just statistics. And, you know, there's many great young people that are advocates on social media that can take their platforms, sit with each other, find an adult who was there at their time and just say, just let us know.
That is, right? Now that's great social media for me. We're going to have to leave it there. Thank you so much for coming in. And looking forward to Friday to see what you guys come up with.
Thank you so much, Juliet. Appreciate it.
There we go. That was AIDS Healthcare Foundation Advocacy Policy and Marketing Manager for the Southern African region, Ngaatendwe Murombedzi, joining us this evening to chat about this week's upcoming International Condom Day.